Welcome to the 2025 Benefits Presentation for Commercial Siding and Maintenance. Welcome to the Benefits Presentation for Commercial Siding and Maintenance. Benefits will begin June 1st of 2025. The Employee Benefits Program for Commercial Siding and Maintenance is one of the most important investments. They are committed in providing you a complete benefits program as part of your total compensation. Your benefit needs are unique, and the program is designed to be comprehensive and flexible so that you are able to choose the benefits that make sense for you and your family. All full-time employees working at least 30 hours per week are eligible for group benefits. All benefits are effective first of the month following 60 days of employment. Your eligible dependents include your legally married spouse and children, including stepchildren and adopted children, until the age of 26 for all benefits. Coverage may be available for mentally or physically disabled child who is 26 or older. Please contact the Carrier or Gravy Employee Helpline at 1-800-424-8274. When you are first hired or become eligible for benefits, you have 30 days to enroll in your benefits. If you do not enroll at that time, you will not be eligible for benefits until the next open enrollment unless you have a qualifying event. Now, during open enrollment, you have the opportunity to make changes to your benefit elections. You must enroll online by May 19th to be effective on June 1st. Except for a qualifying event, you will not be able to make changes to your elections until the next year's open enrollment. Open enrollment this year will be May 12th through May 19th. If you have a qualifying event, you'll be able to change your benefits before the next open enrollment. You must notify Human Resources within 30 days of the change. Some examples include marriage, divorce, birth of a child, or placement of adoption, or loss of other coverage. Gravy Comfort Plan Option 1 with the Aetna Network. The Comfort Plan has a $7,900 individual deductible and $15,800 for a family deductible. Now, this plan is a PPO plan, which is a preferred provider organization. It has in and out of network coverage. Now, we're going to focus on the in network benefit. The coinsurance amount is 100%. The deductible is per calendar year, so it starts from January 1 through December 31st, and it resets every January 1. The calendar year out of pocket is $7,900 and $15,800 for a family. The in-network family out-of-pocket maximum is embedded. The physician office visits are covered at 100%, specialist office visits are covered at 100%, and preventative care is covered at 100% with no deductible. Keep in mind that this plan is a PPO, and you do not have to pick a primary care physician, and you do not need a referral to see a specialist. However, again, some doctors do require that referral, so that includes cardiologist, neurologist, and physical therapist. Diagnostic labs are covered at 100%. Hospitals, no charge after your maximum out-of-pocket has been met. Complex imaging include MRI, CT scans, PET scans. For the hospital is no charge after your out-of-pocket has been met. If they're administered in an office or clinic, they're covered at 100%. Online care provided by MD Live is at no cost. Outpatient hospitalization is at no charge after your out-of-pocket maximum has been met, and this includes inpatient hospital as well. Emergency room is a $250 copay. Urgent care is covered at 100%. Now keep in mind that there's a lot of emergency rooms that are popping up and they look like an urgent care. So, if they have a hospital name tied to it, then that most likely that they're an emergency room. So always ask, are they being billed as an urgent care or as an emergency room setting? Your emergency room copay is $250 where your urgent care is covered at 100%. So that makes a significant difference. The retail prescriptions is a $0 copay for generic, brand name is $75, and then non-preferred brand is $100. That's approved retail at no cost for the Prudent RX. You do also have mail order as also available. For coverage details, please refer to your SBC or your summary benefits plan summary for further details on your out-of-network coverage. There is a spousal surcharge, so if your spouse is offered coverage through their employer but chooses to enroll in commercial siding and maintenance medical plan, there will be an additional surcharge of $200 per month. Again, new users need to register at Aetna.com. Gravy HSA Plan Option 2 with the Aetna Network. The HSA High Deductible Health Plan is a $5,000 individual deductible and $10,000 for family. The calendar year deductible runs from January 1 through December 31st. So keep in mind that it's per calendar year and it resets every January 1. For this plan, it's a PPO, Preferred Provider Organization plan that has in and out of network coverage. Now for this presentation, we're going to focus on the in-network benefits. However, you may look at your SBC's summaries for coverage of your out-of-network benefits. Your coinsurance benefit is 100%. Your calendar year out-of-pocket maximum is $5,000 for an individual and $10,000 for a family. The in-network family out-of-pocket maximum is embedded. Your physician visits, specialty visits, are covered at 100% after your calendar year maximum has been satisfied. Now keep in mind, preventative services are covered at 100%, no deductible. Diagnostic labs and x-rays are covered at 100% after deductible, including complex imaging, MRIs, CT scans are covered at 100%. Now, as a reminder, this plan is a PPO. You do not have to pick a primary care physician and you do not need a referral to see a specialist. However, some of these doctors do require a referral. That include cardiologists, neurologists, physical therapists, all require those referrals. Online care provided by MD Live, which is a $50 copay for general medical, dermatologist a $50 copay, and mental health visits range from $45 to $250. Outpatient hospital, inpatient hospitalization, emergency room, urgent care is covered at 100% after your deductible is satisfied. The retail prescription program has generic, brand name, non-preferred, and specialty drugs. That is all subject to your deductible. Once you satisfy your deductible, you're covered at 100%. And this includes mail orders as well. So keep in mind that everything will go towards your $5,000 individual deductible or $10,000 for family. For coverage details, please refer to the SBC plan summary. Spousal surcharge. If your spouse is offered coverage through their employer but chooses to enroll in commercial siding and maintenance medical plan, there will be an additional surcharge of $200 per month. New users can register on Aetna.com. The Gravy HSA Option 3 with the Aetna Network. The HSA plan is a high deductible health plan that has a $6,350 individual deductible and a $12,700 for family. The in-network family deductible is embedded. The coinsurance is covered at 100%. Now keep in mind that your deductible is per calendar year from January through December, and it resets every January 1. Your out-of-pocket maximum is also per calendar year. Your maximum is $6,350 for an individual and $12,700 for family. The in-network family out-of-pocket maximum is embedded. For physician office visits, it's covered at 100% after your deductible is satisfied. Your specialist office visits covered at 100% after your deductible as well. Now keep in mind that this plan is a PPO plan that you have in and out of network coverage using the Aetna network. If you go out of network, you can be balance billed, so we'll focus on the in-network benefit. On this plan, it is a PPO plan. You do not have to pick a primary care physician and you do not need a referral to see a specialist. However, it's extremely important for you to have a primary care physician. Some specialists do require referral. Again, your plan doesn't require it, but your actual doctor does. It includes chiropractic services, physical therapist, cardiologist, neurologist, rheumatoid arthritis, and anything with an "ist" behind it is a good example. Preventative services are covered at 100%. Diagnostic labs are also covered at 100% after your deductible. Complex imaging is covered at 100% after your deductible that include MRI, PET scans, CT scans. Online care, general medical is a $50 copay, dermatologist is a $59 copay, and mental health visits range between $45 to $250. Outpatient hospital, inpatient hospital, emergency room, and urgent care facilities are covered at 100% after your deductible. Now, your prescriptions, whether generic, brand name, non-preferred brand name, and specialty drugs, are also covered 100% after your deductible. It's extremely important to find out how much your medications fall under or what their amounts are before you select the high deductible health plan. Again, you'll be responsible for 100% until you reach that $6,350 for an individual and $12,700 for a family. For coverage details, please refer to the SBC plan summary that's offered to you as well. Now keep in mind there is a spousal surcharge if your spouse is offered coverage through their employer but chooses to enroll in commercial siding and maintenance medical plan. There's an additional charge of $200 per month. Please refer to your benefit guide for details about your reimbursement for the high deductible health plan under your HSA account. Let's review the minor details so you know the basics and get the most of your plan throughout the year. The more you know, the easier it will be to make the best decisions for your health and your finances, especially when it matters most. Gravy has partnered with commercial siding and maintenance to provide benefits that you could actually use. Comfort is the first of its kind health plan that offers 100% coverage for the most common healthcare services when accessed in a clinic or doctor's office visit. There's no cost, including preventative services, primary care in a doctor's office, specialist visit at a doctor's office, urgent care visits, physical therapy at a doctor's office, generic medications and prescriptions, specialty prescriptions with Prudent RX, virtual services, mental health and care in the doctor's office, and much more. Having such good health insurance that covers so much is such a huge impact to most of their employees and their dependents. Gravy partners with the Aetna Signature Administrators to provide a broad access to quality coverage. The Aetna Signature Administration offers them one of the most leading preferred provider organization, also known as a PPO, a network for physicians, clinics, hospitals, and other healthcare providers who agree to deliver the quality care, cost-effective, and healthcare services. With the Aetna Signature Administrators Program, the PPO network, you'll have access to over 1.2 million participating doctors, 8,700 hospitals, and comprehensive discounts as well. Your generic drugs are covered at 100%. Your preferred brand and non-preferred brand name and specialty drugs, you will want to look them up on your formulary drug list, where you can log into member.gravy.com and click Drug List on your health plan to search for prescription drugs. Gravy partners with health and wellness industry leaders to give members access to a suite of digital services that aim to enhance their health and wellness journey. For health plan members 18 years or over, get unlimited access to FitOn's library of 30,000 virtual classes, including cardio, HIIT, yoga, Pilates, meditation, dance, and so much more. In-person fitness perks are available for qualifying members. Gravy's Fitness Partners removes barriers that often prevent members from achieving their health lifestyle through diet and exercise. Health plan members 13 years or over have access to SWORDS. SWORDS clinical grade digital physical therapy program helps members overcome musculoskeletal pain through personalized care for licensed physical therapy, innovative senior-based technology, and unlike traditional physical therapy, members have access treatment whenever it's convenient. For healthcare members, they also have access that including general medicine, dermatology, and mental health for 18 years or over through Teladoc Health, which is the world's largest in-whole person virtual care. Mental health care includes clinical services such as psychiatry, physical for therapy visits, as well as non-clinical services such as mental health coaching and digital programs. All your favorite Gravy benefits in one simple place. Use the Gravy app anywhere to get the care you need and when you need it. The app features access to your digital ID card on the spot, see what's covered under your plan, find in-network providers, clinics, pharmacies, and much more. You can view your claims and track your expenses throughout the year. Connect with a Gravy Care licensed experts available to answer your health benefits questions. Members are enrolled in the comfort can view the list of no-cost services including in their plan. One of the best ways to stay healthy and to save on your healthcare costs is to take advantage of the preventative care services that are available to you at no additional cost. With Gravy, you have access to over 80 preventative care services, including annual wellness exams, select health screenings, vaccinations, select counseling services, supplements, preventative care prescriptions, and medical devices, and much more. Please review the Preventative Care 101 slide that provides detailed preventative services. For a complete list of all preventative care included in your plan, please refer to your summary plan description found in your Gravy member account. As a reminder, your Gravy account has access to all the tools you need to get the most of your employee health plan benefits. You're able to search for providers, access your digital ID card, track your out-of-pocket maximum, and view your claims online. Log into your account and have access to the member.gravy.com website. Health benefits that you can actually use. Now, once you choose the plan with the out-of-pocket maximum that works best for you and your family, with comfort, the most common healthcare services are covered at no cost, and they're here to support you in getting the most out of your plan. Now, here's an example. Taylor hurt his ankle on a run. He visits his orthopedic specialist in a doctor's office setting for a checkup. His out-of-pocket cost would be $0. Again, preventative care, specialist visits, doctor's office, urgent care, virtual visits are all covered at 100%. If you have a medical expense, Gravy Pay allows you to split the bill into predictable monthly payments at no interest, no fees, and no hassle. Gravy Pay is powered through by Patient, a company that specializes in helping employees pay for care. Patient is a lender behind Gravy Pay. So how it works, Gravy Pay is a virtual card when paying a bill either online or over the phone simply through the Gravy Pay card. Information is the same way that you would provide your debit card or credit card. Now, Gravy Care can be used for any out-of-pocket medical expenses for yourself, dependents. The merchant codes are used to verify the expenses for healthcare related. Now, how do you sign up? Now, once you're enrolled in the Gravy Health Plan, activate your Gravy Pay by providing and completing a short enrollment process through member.gravy.com. You'll immediately have access to your virtual card, and you can start as soon as your benefits begin. Easy view transactions to manage your payments at any time on your Gravy account. When it comes to big purchases today, consumers expect flexibility, options for payments. So why should your healthcare expenses be any different? You'll have access to your Gravy Care providers at 855-451-8365, or you can send a secure email as well. Gravy Pay is just another way of improving how people purchase and have access to healthcare. Gravy Pay improves access to healthcare by allowing you to pay for out-of-pocket medical expenses at your own pace. Now, this is simple, streamlined, and flexible at no cost to you. No interest, no credit check, and it's available through Gravy member site, and it's powered through Patient, and it's supported by Gravy Care. Now, here are the simple steps. Get the care that you need, including medical procedures, prescriptions that are subject to your out-of-pocket responsibility. Initiate Gravy Pay. Access Gravy Pay through the member account portal and use Gravy Pay to pay for your portion of the bills that you receive from your provider. The repayment process, select a monthly repayment plan that works for you, paying at your own pace without fees or even interest. Now, if you have any questions, you could reach customer service at 866-863-6232, or you could send a secure message through member.gravy.com/contact. Now, don't forget to use the Gravy mobile app for all your favorite benefits in one simple place. You could have access to your digital ID card in one spot, view your plan information, find in-network doctors, and view your claims information. Through the Gravy app, you're able to view benefits that are covered at 100%. You'll have access to the Gravy Pay and also access to the best-in-class virtual care and fitness perks through Teladoc, Sword, and FitOn. CVS Caremark is helping you save money on your medications. Now, we all know that keeping your out-of-pocket costs low is important to you and your family. That is why they created Caremark. Now, how the Cost Saver works. Cost Saver makes sure that you get the lowest possible cost of your medications covered under your group health plan. Now, all you have to do is present your CVS member ID card when you pick up your prescriptions, and they'll manage the rest, and you'll automatically applying the lowest cost discount price. Now, the cost saver benefits include providing you the best possible prices for many commonly prescribed and non specialty generic drugs, automatically applying your out of pocket costs to your deductible and out of pocket thresholds, delivering you a seamless experience that avoids wasted time shopping around for the best price. If you have diabetes, you know how important it is to check your blood glucose levels regularly. And we want to help with a new no-cost AccuCheck or one-touch blood glucose meter. It's part of your prescription plan, and ordering is easy. Order your new meter today. Visit caremark.com managing diabetes, select to request a meter, and follow the instructions on the screen. It's that simple. CVS Caremark Mail Services can deliver 90-day supplies of your medications when you take regularly just to your doorstep. For even more convenient, start automatic refills. 90-day supplies typically cost less than a 30-day supply. So you can learn more by going to care.com/RX delivery or scan the code below. The dental plan will be administered by Guardian. The PPO plan is a preferred provider organization. You'll have access to the largest dental plan network with 2 reimbursement levels that give you more control over savings. You'll have access to save money with any dentist in the Guardian's network. When you belong on the Tier 1 reimbursement level, you'll maximize your savings. Reimbursement for covered services received for non-contracted dentists will be based on Guardian's fee schedule. So let's review the PPO Tier 1. The Tier 1 calendar year deductible is $50 for an individual and $150 for a family. The deductible is waived on preventative services. Preventative care is covered at 100%. Basic services are covered at 80%, meaning you'll be responsible to pay 20% after your calendar year deductible of $50 per individual. The major services are covered at 50%, so the more it hurts, the more money you'll be paying out. And orthodontia coverage is for children only, and it's at 50%. For Tier 2, it's out-of-network services. Now keep in mind, this is what you'll be reimbursed amount up to the contracted amount. So preventative services are covered at 100%, basic services are covered at 80%, and major services are covered at 50% as well. So is orthodontia coverage, is covered at 50%. Now the calendar year maximum for the benefits is including $1,500, and it includes a maximum rollover. The rollover threshold is $700, the rollover amount is $350, and the rollover limit is $1,250. The lifetime orthodontia maximum is $1,000, and this applies to all levels. Dependent care limits is up to the age of 26, and this applies to all levels as well. Regular visits to your dentist can prevent and detect the early signs of a serious disease. That's why Guardian's Maximum Rollover Oral Health Rewards program encourages and rewards members who visit the dentist by rollovering part of the unused maximum into a maximum rollover, MRA. This can be used in the future years if your plan's annual maximum is reached. Now again, your plan annual maximum is $1,500. The threshold is $700. This is the claims amount that determines the rollover eligibility. And then the claims rollover amount is $350. This is additional dollars added to your calendar year maximums for future years. And then the maximum rollover account limit is $1,250. Now this is the limit that cannot exceed within your maximum rollover amount. The vision plan is administered by Guardian. Significant out-of-pocket savings are available with your full-featured plan by visiting one of VSP's network locations, including one of the largest private practice providers, which include VisionWorks contracted ProVision locations. Your network is the VSP Choice Network. Your eye exam copay is $10, and your materials waived for elective contacts is $25. Now, before we get started, just want to remind you that you do have in and out of network coverage. We want to focus this presentation on the in-network benefits. However, you can get reimbursed for out-of-network benefits. Your eye exam copay is $10, which includes your single lenses, your line bifocals, line trifocals is a $10 copay. Your frames is 80% amount over $130. If you go to Costco, Walmart, Sam's, you do have an allowance amount over $70. Your contact lenses amount is $130. And then your contact lenses that are medically necessary are $0. Medically necessary include a diagnosis of keratoconus as an example where you become legally blind. Contact lenses include 15% of the usual and customary charges, and cosmetic extras average between 20 to 25% of a retail price. Your exams are once every calendar year, and lenses for glasses or contacts are once every calendar year as well. Your frame allowance are every 2 years, so keep that in mind. So every 12 months for your exams, every 12 months for your lenses from January through December, and every 2 years for your frames allowance. Guardian administers the life and accidental death and dismemberment coverage. You have a voluntary term life insurance benefit that you qualify for. It's at $10,000 increments to a maximum of $500,000. This includes accidental death and dismemberment for yourself, spouse, and for your children, which includes a maximum 1 times the life amount. For spouse benefits of $5,000 increments to a maximum of $250,000. The child benefit is your child is eligible from birth to the age of 26. You may elect one of the following benefits options of $10,000. The guaranteed issue amount means that you are not required to answer any health benefit questions to qualify for coverage, including for a specific amount, when you sign up for coverage during the initial benefit period. Now, the guaranteed issue amount for less than age 65, for an employee less than age 65, is $150,000. For 65 through 69 is $50,000, and 70 plus is $10,000. Spouse less than the age of 65 is $25,000, and 65 through 69 is $10,000, and dependent children is $10,000. Now, the premiums do increase on the plan anniversary after you enter the next 5-year age group. The portability allows you to take advantage and take coverage with you when you terminate employment. There are some age and other restrictions can apply. Now keep in mind, it is important for you to have a primary beneficiary and a secondary. We encourage you to include dependents over the age of 18, otherwise that money will go into a trust fund until that child reaches 18. So it's very important for you to have a primary and a secondary beneficiary. You could change your beneficiary at any time. Your life insurance coverage includes accelerated life benefit, which is a lump sum benefit that is paid to you if you are diagnosed with a terminal condition as defined by the plan, Waiver of premium is include premium will not need to be paid if you are totally disabled. Benefit reductions are reduced by a certain percentage as the employee ages, so 35% at age 70 and 50% at age 75. Your disability benefits are administered by Guardian. You have the option to elect short-term and long-term disability. Both short-term and long-term are completely voluntary. You can elect one or both. Coverage amount is 60% of your salary to a maximum of $1,200 for short-term disability. The maximum benefit period is the length that you could receive your disability benefits, which is 24 weeks. For accident, the benefit begins on the 15th day. For illness, it begins on the 15th day as well. The guaranteed issue amount for the coverage is $1,200. Does have a pre-existing condition. It has a look-back period of 3 months, which is going to see if you were diagnosed, treated for, or taken any medications. If you were, then that condition will not be covered after 12 months. The premium is waived if you are disabled and not be able to return to work. For the long-term disability, it's 60% of your salaries to a maximum of $6,000. The maximum payment period is lesser than 5 years or age 70. The accident begins on the 181st day. The illness benefit begins on the 181st day as well. The guaranteed issue amount is $6,000 benefit. Now, this plan also has a pre-existing condition. It goes back 3 months of your effective date to see if you are diagnosed, treated for, or taken medications. If so, then that condition will not be covered for 12 months. Understanding your benefits and disabilities is extremely important. For the first 2 years of disability, you'll receive the benefit payments while you are unable to work in your own occupation. After 2 years, you'll continue to receive benefits if you cannot work in any occupation based on your training, experience, and education. Earnings definitions is when your covered salary excludes bonuses and commissions. Now, there is a special limitations which provide a 24-month benefit limit for specific conditions including mental health, substance abuse, or other conditions such as chronic fatigue, or including those limitations. There is a work incentive program the plan offers that will not be reduced for a specific amount for months that you are working part-time while you remain disabled, unless you combine the benefit earnings to exceed over 100% of your previous earnings. Your critical illness benefit is administered by Guardian. Employees may choose a lump sum benefit of $5,000 to $50,000 in $5,000 increments. Conditions include cancer, vascular, which heart attack and stroke, and heart failure. The benefit will begin on the first occurrence 100% for innovative cancer, and skin cancer is $250 per lifetime. Second occurrence for cancer is 50%, and for skin cancer is not covered. Heart attack, again, is covered at 100%. Heart failure is covered at 100% for the first occurrence, and then second occurrence is covered at 50%. Other conditions include organ failure or kidney failure. Critical illness benefit is also offered for the spouse and for the children. For the spouse, you may choose a lump sum benefit of $5,000 to $50,000 in $5,000 increments, up to 100% of the employee's lump sum benefit. The child benefit is for children from age birth to age 26, which is 25% of the lump sum benefit. The benefits reductions do apply and they're reduced by a certain percentage of the employees as the employee ages, which is 50% to age 70. The guaranteed issue amount is $10,000 for the employee, and for the spouse is $5,000. For a child, it's all amounts. Health questions are required in the elected amount that exceeds the guaranteed issue. The affordability allows you to take your critical illness coverage with you if you terminate employment. Now, the pre-existing conditions includes any condition for which the specified time period prior to your plan effective date. If you were consulted by a physician, received treatment, or taken medication, it goes back 3 months prior to your effective date and 6 months treatment free and 12 months after. The wellness benefit per year is $50 for yourself as the employee, $50 for your spouse, and $50 for the child. There are certain condition definitions, which is stroke must be severe enough to cause neurological defects at least 30 days. In heart failure, the insured must be placed in an organ transplant list in order to be eligible for heart failure benefits. Please see the other exclusions as well. The accident benefit is administered by Guardian and it's 100% employee paid. The accident benefit is off the job only. And it also allows you to take the accident coverage if you terminate employment. The benefit amount for the employee is $10,000, for the spouse is $5,000, for the child is $5,000. This includes catastrophic loss, for hearing loss in both ears, loss of function, and also common carrier benefits include 200% of accidental death and dismemberment benefit, common disaster benefit of 200% of the employee accidental death and dismemberment of hand, foot, or sight due to an accident, which includes 50% of AD&D or multiple 100% of AD&D as well. Dismemberment of thumb, hand, 4 fingers, and same hand, all toes, same foot, which include 25% of accidental death and dismemberment. Reasonable accommodations to home or vehicle is $2,500. The wellness benefit limit is $50, and for the children, age limit is from birth to age 26. Now, here are a few examples of how the accident benefit through Guardian will help pay. If you were in a coma, it'll pay you or your spouse or your children $7,500. For concussion, baseline study is $25. Other concussions is $100. Dislocations up to $3,000. Doctor follow-up is $25 up to 6 treatments. Emergency dental work is $200 for a crown and $50 for extractions. Emergency room treatment is $150. There's other examples here where family care visit or hospital ICU visit will pay for the is $1,500, and then ICU hospital confinement is $300 in the event of an accident. Your accident coverage includes the common disaster, which is a benefit that is paid if both you and your spouse die in a covered accident or separate covered accidents within the same 24-hour period. Reasonable accommodation is the benefit that is payable if modifications require the insured placement of residence or vehicle due to an accidental death or dismemberment or catastrophic loss. The emergency room treatment benefit is paid only when the insured is examined or treated within a 72-hour of the covered accident. The X-ray benefit is $30. Now, there is a transportation benefit as well, which is paid if you have to travel more than 50 miles away to receive special treatment at a hospital or facility due to a covered accident. And the benefit will pay 50 cents per mile, limited to $400 round trip, up to 3 times per accident. The hospital indemnity coverage is administered by Guardian. This is 100% employee paid. The hospital ICU admission is $500 per admission, limited to 1 admission per insured and 3 admissions per covered family member per benefit year. The hospital ICU confinement is $100 per day, limited to 360 days per insured per benefit year. The pre-existing condition goes back 3 months to see if you're diagnosed, treated for, or taking medication. You have to be 6 months treatment free and 12 months after. The portability allows you to take the indemnity coverage with you if you terminate employment. The coverage age limit for children is age birth to 26 years. In understanding your hospital indemnity, here's a few things that you must know. Hospital admission and hospital ICU admission benefits are not payable on the same day. The premium will be waived if you are hospitalized for more than 30 days. And hospital admission or confinement benefits are not payable for newborn unless the child is admitted to neonatal ICU. Hospital ICU confinement benefits are not payable on the same day as the hospital ICU admission benefit. After the initial enrollment, hospital indemnity coverage will continue as long as the insured is actively at work. Enrolling your benefits literally one step at a time. Your Employee Navigator company identifier number is CSM 8660. Now let's begin. Step 1. Log in. Go to employeenavigator.com and click Login. For returning users, log in with your username and password that you selected and request and reset a forgotten password. For first-time users, you will need to click Register in the email that you received from your admin team. Register as a new user, create an account, and create your own user name and password. Now, step 2. Welcome to Employee Navigator. Now, after you log in, let's begin to complete your required tasks. Step 3. For onboarding for new-time users, you must complete the onboarding tasks that were assigned to you, and then you could start your enrollment. Step 4. Starting and completing your enrollment. Don't forget to have your dependent details handy. To enroll a dependent coverage, you will need their date of birth, their gender, and their social security number. Thank you again for participating in this presentation, and we look forward to supporting you and helping you throughout the year.